Okay, everyone. So my soap note is going to be a pediatric patient that I saw. Her name is Gigi, and she is a 40-day-old African American female who was brought to the clinic by pretty much her whole family, her mom, her dad, and her two siblings. She came in with for a complaint of a rash that is spreading. So the HPI, as per mom, is this rash that appeared about 4 days ago. The rash started on the baby's neck and then proceeded to the face and then to the trunk. Okay, so mom, she denies any fever with the baby, any cough, any vomiting. She denied any sick contacts or exposure. None of the other family members have this rash. The baby's only 40 days old. Up until now, there's been no other allergic reaction or anything like that. No problems with the baby up until then. This is the baby's first sick visit. Okay. Baby was vaginal delivery, no complications with birth. She is doing well on her growth chart. I spoke with the mom about the baby, like eating. Baby's still eating every 2 to 3 hours, sleeping well. Nothing abnormal with the baby, she states, besides this rash. Okay, so upon examining the baby, the physical is basically within normal limits except for the integumentary part, and the baby does have like a macular-papular rash on the noted on the cheeks, on the neck, extensively on the neck. It's really you can see like really red and the raised bumps. There is no oozing or any drainage or anything like that to make me think that there was some type of infective process going on. The rash is also on the baby's trunk. It was on the front and the back, and also a little bit on the thighs. When we took a look in the diaper area, she had no rash there. Okay. Mom says that she only uses Johnson & Johnson products. That's all she's used for the baby since the baby was born. She uses that to wash the baby, and she uses the lotion, and she also used Desitin in the diaper area. Other than that, she says she's not put anything else on the baby. Baby doesn't take any medication. Baby is being breastfed. So kind of spoke to the mom about what she eats, if she had eaten anything different, maybe in the last couple of days or something like that, where it could be affecting the baby. Mom says that she hasn't eaten anything differently. I asked about medication, and then it came to find out that the mom is taking medication now. She started taking amoxicillin for a tooth infection that she had, and she actually finished it the day before they came. So that was something new. I'm thinking maybe that had something to do with it, but I don't know. My doc's not so much. So, so basically for this patient, the differential diagnosis that I came up with was atopic dermatitis, allergic contact dermatitis, and I was thinking something viral, but I kind of excluded that because patient had no fever, right? Patient had no fever, so we just basically diagnosed the baby with eczema. For the baby, we was a lot of education for the mom. We just talked about maybe changing, we just talked about what kind of detergent she used to wash the clothes, to try to use something hyperallergenic, making sure that she rinses the clothes twice, not putting on anything new on the baby without washing it, treatment for the baby's skin, using hypoallergenic products. The doctor in the office that I'm in, he likes CeraVe products, so he recommended that to her. We prescribed 0.05 hydrocortisone cream and told her how to put that on with just a fingertip unit, you know, just a little, and then basically spreading it, and then just spreading it on the body sparingly, and then less, especially on the face and on the neck, on those folds, because the skin is very thin there. We talked about her diet and just being aware of what she eats anytime she tries anything new, you know, to see how it affects the baby, to make sure that she is aware of what she eats, and maybe to try to avoid really spicy foods or anything with a lot of acid like tomatoes and stuff like that. And then also we spoke about with baby comes in contact too, just paying attention to the baby's skin and what they touch and stuff like that. They didn't have any pets, you know, they didn't have any carpet. We just talked about you know, common allergies of children and to just be aware of those things. So that was pretty much it. That was like my first pediatrics encounter. So I'm gonna use baby Gigi. So if you have any advice or any comments, looking forward to it. Thanks.